Hi everyone, this is Stephanie Norton with Therap. Thanks for joining our scheduling EVV webinar today. We still have some people joining us, so while we are waiting for everyone to get on board, I've got some polls that I want to run through. So I'm going to launch this poll and just take a second to respond. We've got 3 or 4 questions for you today, but we'll make them quick. All right. Thanks for voting on that. I'm going to go ahead and close that and we'll look at the results. So here are our results for Therap users. The majority of us here are already using Therap in some capacity, but we do have some newbies, so welcome. So let's find out a little bit more about you. Are you currently using Therap's billing and or scheduling EVV module? And you can check as many of those answers as you need there. Okay, thank you very much. Let's look at those results. So we've got a good number of billing module users, some scheduling EVV module users, welcome. Thanks for coming. And a lot of that are using neither of those. All right, here's a different one. One of the things we're going to be talking about today is EVV, obviously, and we're wondering, have you decided or has your agency come up with a solution for bringing your own device or having staff use their own personal devices for documentation? Great, thank you for that. All right, for the 33% of you who have figured it all out, we can't wait to hear what you've done. All right, and last poll. Is your agency ready for the January 2020 EVV mandate? Perfect, thank you. Let's take a look at that. Isn't it always the 1% who've got it all figured out? We can't wait to hear from this 1%. A lot of people working on it, that's great. And then a good number of people that we're going to help you figure out what EVV is all about today. Thank you for participating in that. That just sort of helps us guide this conversation a little bit more. And Jeff Case, who is the National Director of Business Development, is going to take it away.
All right, thanks, Stephanie. Welcome, everyone. Glad to have you a part of our EVV webinar this holiday week. Thanks for joining us. Appreciate your time. I want to start with my co-presenters here. Nadine Sturgis, our Director of Billing and Special Projects, will be sharing some important information in regards to claims and billing later on in our session today. And then Stephanie, who is also a Senior Training and Implementation Specialist, that's been really key in just from the beginning working with our EVV platform and project. So thanks to both of them for joining me today. Just for those of you joining not familiar with Therap, we are certainly a comprehensive platform that provides a solution for really all of your documentation needs across many programs and services. With that in mind, our EVV solution is certainly part of that comprehensive solution. It's not something that's completely separate or one-off. It's very much embedded, integrated into our solution, and for that reason the Therap system takes advantage of those other modules that many of you, as you said, have already been using it, and you will find to be useful in just the information that will ultimately be gathered and put together in regards to your claims and billing for EVV at the agency level. So hopefully you'll see that throughout our presentation today and the value for that as just an integrated piece of our comprehensive solution. We have several that are dedicated to just the deployment and assisting your agency in coming on board and getting EVV implemented and ready to go for this mandate. And you see some of those on the screen there that certainly are standing ready and ready to assist your agency. Just a little bit about our just presence in this particular area. We are a part of the National EVVA It's the National EVV Association. We are a charter member of that particular organization. If you haven't looked that up, it's a great website. Coming very soon to you on that website will be a state-by-state integration tracker that I think will just be a go-to for folks to be able to have a sense of what's going on state to state and the success of that integration across those states. So if you're not familiar with that particular website, certainly mark that down and go to that, especially in the upcoming days. I think you'll find that very valuable as the integration tracker gets posted to that site. So take that information and check that out. So let's get started with just EVV. Where did it come from? Certainly EVV is not new. It's a technology solution that is all about home and community-based services and delivering that services to the people that are needing it. EVV goes back to actually 1996, as you see there, from a nurse in Akron, Ohio, who is just focused on efforts to strengthen home and community-based services, and in particular, home health. And from that, this tool really was born, and out of that was this whole sense of being able to capture that. It reduced fraud and folks getting the services that they were needing to be supported. And it certainly has taken on new meaning with the federal mandate that has become a part of the 21st Century Cures Act. That federal requirement now that all states will take and have the ability to incorporate EVV into their services, and specifically for personal care services and home health services. This spring, there was some clarity and some updates that was provided from CMS just about the federal mandate. So many states have been looking for some direction and clarity on some of the elements of the mandate, and so this spring we got some of that clarity from CMS, who provided some additional definitions and information about EVV as a whole. One was that indeed the Cures Act was to be implemented starting January 1st, 2020, and that pertained to personal care services, and then January 1st, 2023 for home health care services. Keep in mind that it's not limited to just those things that fall under personal care or home health per title, but even services that have the elements of personal care services or home health care services, even if it's by a different name, but included in a waiver, included in a state provided service, that it still was subject to EVV. And to put a little teeth, if you will, in this as a federal mandate, there were penalties that were listed for those that did not come into compliance with EVV. You see those listed there, in that states that do not comply with this, they will have their FMAP reduced. You see that kind of escalates the longer it takes for them to come into compliance with that. But that's kind of the consequences for not getting EVV up and running in a particular state. Some of the different waivers and different Medicaid authorities subject to the EVV requirements for both personal care and home health. You see those listed there. Also, the clarity that EVV requirements did not apply to the program of all-inclusive care or the PACE program for the elderly. That was not included in this, but all those others did fall into line with EVV requirements. And again, as I said, the states have a lot of flexibility in regards to this, and we'll see this through some of the models and other elements that has transpired since this particular information dissemination from CMS. But just some of the things that were provided for clarity. PCS, there's a lot of ways that folks have described that, but in general, it consists there from the definition of services supporting activities of daily living, or ADL, such as movement, bathing, dressing, toileting, transferring, and personal hygiene. Also some IADLs there as well that were part of the definition for PCS services. In addition, those not considered, and this was some of the confusion that did exist, was those PCS services that were in a congregate setting, and CMS interpreted that those specific PCS in-home services that were congregate residential settings where 24-hour services available and shift-based care reimbursed, those were not going to be included in the EVV requirements. So ICFs and other situations that many of you provide services for, those particular services would not be included. Also, PCS services that do not require an in-home visit, those also wouldn't be included in this. From the home health, again, which begins January 2023, any home health services that the state has opted to cover under their state plan or under the waiver that they have that require an in-home visit, those two would be subject to the EVV requirements. And again, something consistently that they've said is even if it's not specifically called PCS services or home health, but it fell into those qualifications of what those services provide, and those were in-home visits, those would be under the EVV requirements and needed to be taken and also used for gathering the required information for EVV. Those requirements you see right there, those are 6 defined requirements of just EVV gathering: type of service, individual receiving the service, date of the service, location, individual that is providing the service or staff, and then the time service begins and ends. So those are all the data points that need to be captured in an appropriate EVV system that is verifying the actual visit. You can certainly see those as we go forward in the Therap solution, and we're gonna go through those and show exactly where those take place. Keep in mind too, as we go through this, if you've got particular questions that you'd like to see us respond to, you can ask those as well in the questions section there of your menu on your screen. Flexibility for states. States may select their EVV design and implement quality control measures of their choosing. We're going to see several models that folks have used in different states, and that's really been some of the delay, quite frankly, with some agencies and folks trying to get ready for the Cures Act and for EVV requirements is the state's decision-making process, and they all have a lot of things in regards to getting stakeholder input and getting all of their kind of ducks in a row to figure out exactly what they were going to do, and many of them trying to reach out to states that have been successful or have been doing this in previous years. So a lot of states have been reaching out trying to figure this out through the process of this mandate that's come down, and with that they also have just a tremendous amount of flexibility in their choosing and putting this into practice. With that in mind, there have been what we've seen to be 5 different models of design that states are opting for. A provider choice model that many states have went to, and that is the direction that they're going with. The provider choice is a model in which providers, agencies that have complete flexibility to choose whichever vendor that they have up, or if they have their own system, they're able to use that, and then they would feed that information to a state aggregator that would collect the EVV data from all the different systems. So that's one model that many states are going to. Another one is this managed care, which, if you're in a managed care state, there are different MCOs that often are represented there, and in that particular model, they are allowing the managed care companies to choose the EVV platform that you would be using, and then that would then be the data would be sent in and provided to the MCO. the issue there is that if you've got multiple MCOs, you could be having to use multiple systems to collect that. So a challenge in some of those states with that as an option. The state mandated in-house is just that. The state has chosen to create an EVV system, and that's the only option that you have. And so you're going to be using what the state has come up with and have deployed and are going to be using. Very similar to that's the next one, and that's a state mandated external vendor where they choose a vendor like Therap, and we certainly are one of the vendors that one state has chosen to be their option. And that state selected vendor then provides the EVV option that all of the providers in that state will be using to collect the EVV and submit that for payment. And then one last model that we've seen is also an open vendor, a little different than the provider choice. This is one where the state chooses one EVV vendor and operates that, but it also allows for other EVV options to be used. You don't have to use the state option, but you will have the option to use others, and then all of that again is brought together through a state aggregator. So very important to try to figure out exactly what option is applicable to your state. Again, these are the 5 that we are currently familiar with and have seen across several of the states. There could even be additionals, but these are the models that we've seen the most and are currently familiar with, and we'll continue to look at again off of the NEVVA site to see if there are any other models that are originated or deployed. CMS anticipates as well, starting this month, the ability for those states that deem that they're not going to be ready to go by January 1, the ability to put forth a good faith effort request and the ability for an exemption. Even if you do get an exemption, the extent of that exemption is for 1 year. If that is recognized and allowed through CMS and through that good faith request. But that starts actually this month, July 2019, for states that don't feel like they're going to be ready to begin to start requesting that exemption. So that's where we'll start to again see where states are through the integration tracker and where they're going. So with that in mind, we've got this mandate for most will start January 1, 2020, and it's something that all of us need to be not only paying attention to, but getting ready for. And again, as Stephanie said at the beginning, a significant part of this, I think, for a lot of agencies is not just the EVV requirements, but is also just the sense of the whole bring your own device and working with the devices in your workforce. And this is a significant question that I know a lot of agencies are dealing with in regards to just the policies and the usage and the cost, and where they're going to use that, how they're going to use those devices. And so this is something that I just think if you've not tackled at your agency, regardless of where your state is and what's going on there, this is a really significant point that has to be addressed and has to be kind of figured out at the agency level. And if you've not done that, that probably is something that you can go forward with and get going on even before the EVV gets all established in what your state is doing. So certainly begin to figure that out. This isn't going away. We've seen in states actually, even as they look at EVV, there are some states that have been doing this for a few years now, and those states aren't just looking at EVV, they're also looking at outcomes associated with the actual service that is provided. So again, if you think EVV is the end result, it's not. It's really the beginning for most. There's this sense of that they want to make sure that there is visit verification for the service that is done at the location that it's supposed to be done at. And then beyond that, in some states, they're going to the point of wanting to see what kind of service was done, what kind of outcomes were actually accomplished in the service provision. So again, that's one of the reasons why we're so excited about what we have, is because we don't just offer the EVV portion, we have connected within this and a part of our solution, the ability for you to track way more, even to the valued-based outcome and to the accomplishing of the outcomes that you're working with at the visit in support. So something to just be mindful of as you look at your EVV solution selection, not just doing EVV, but looking at where this is going as a whole and being prepared in the future for what continues to evolve in just providing community-based services. Just from an overview, I think this is a helpful slide that we want to take a look at, and it really from a high level gives a sense of how EVV works, where the authorization that you would receive either from the state, from a managed care, an oversight entity, and receiving that particular authorization to provide service, and from that, the ability to schedule staff to provide that service to the individual that is receiving either home health or PCS community-based services, the ability to then out in the community to provide that service and do that through our mobile app. We have some features of that mobile app that Stephanie's going to get into that are really helpful and beneficial to your staff in being able to do what they need to do in real time. And so they're able to capture that through the app, the EVV, again, different pieces that are required. That then goes in, that information is validated, and then as you can see, gets processed out for claiming and gets linked up with all of the EVV data for payment. Again, another significant part of this, as you see across the bottom, is, and again, certainly is right in line with your BYOD elements, is the security and the availability and the QA. All of those things need to be into consideration when you start thinking about not just EVV, but data capturing in the community as a whole. And some of the features that are a part of the Therap system and the security that comes with that is certainly is safeguards and elements that certainly put your agency in a position to mitigate some of the risk management that certainly is inherent in providing these services. Much more granular view of that same slide, but again, you see the scheduled slot. Many of the things that if you are using Therap and other services, you may have a lot of this information in from the service auth, your different information, your individual data, all of that you can see, as well as the calendar, and then your staff's ability to check in and check out with the mobile app, or they're able to do that through a computer, but I sense that most are going to be doing this through a handheld device. You see there the 6 different elements that are required in the Cures Act that need to be captured, and then in the Therap application where exactly those would be captured through the service auth information going in, and then clear through. We do have not only the GPS feature, but also the time and date stamping, and some of the other elements that are a part of it, of electronic signatures that certainly give the system and the solution a robustness that allows you to be confident that the not only verification of services taking place, but all of that is accurate and available to you. Again, some other added features that I want to just briefly touch on is there are many of our agencies that we work with in different parts of the country that also deal with just receptivity and connectivity with the devices. And we do have solutions for that. We have this interactive voice recognition, which has the ability to go through telephonically. We do also have an offline version of the mobile app that you're able to go through. And then once you come back into connectivity, the ability to sync that. Stephanie's going to highlight a little bit of that as we get in the actual application. But those are, again, elements as you're looking at a EVV solution, some things that you certainly want to take into consideration and weigh as you're making that selection. Again, some of the different aggregators as well that we're aware of, TELUS, SANData, and First Data, all of which we're currently working with in regards to different states that have selected these as aggregators, and we're actively participating with them in regards to just making sure that our agencies that are in those states are up and ready to go and able to utilize our solution and provide to those different aggregators the needed claim data that will be necessary for payment. So that's kind of from an overview standpoint where we're currently at with just this as a whole. Nadine's going to get into more of just the workflow and the data and the claims data and how those kind of get coupled together for payment into the aggregator validations and payment. And with that, I'm going to turn this over to Nadine and then to Stephanie as we get into the actual application and the ability to look at the system up and running.
Yeah, I want to take a look at this a little bit here because as Jeff has talked in the previous piece here, he's talking a lot about EVV and billing, and those pieces overlap so heavily. The same pieces of information that you're going to be using for your EVV data also contribute to billing. And so our system works so well because you have that scheduled slot and the individual is approved for services, first of all, because they have an authorization. And then that through that scheduled slot, you're collecting some of that EVV data, such as, you know, who's being served and who the individual is that you're serving, that, you know, where you are in the check-in and check-out. And then from that one scheduled slot, you have collected all of that information. And what happens is that depending on the model that your state has chosen, you may or may not have to send EVV data in a couple different ways and your claims data. But the best thing is that you're collecting all of that information, EVV data and claims data, from the same scheduled slot in our system. So when that information gets sent off to your EVV aggregator, First Data, SANData, or, you know, whoever the aggregator may be, or if it's a state, you know, mandated issue or whatever it is. And then if you send claims data, I mean, those two pieces are sometimes they're being sent together and sometimes they're being sent separately. In this case, SANData we're seeing is a big you know, aggregator throughout many states as well as First Data. And so you're sending that information to separate places, but it's meeting up. So if you're creating that information in our system from the same exact point, when it goes through all of those validations, of course it's gonna be validated instantly, and you're gonna get paid for services because you're creating the data from the exact same point in our system. So if you can use that system for both pieces of data, your transition to EVV is going to be seamless because you're using the same information in multiple ways to meet all of those requirements from EVV in your state, as well as your claiming information as well. So let's take a look at the information here. Stephanie, I think you're going to get into the system and share your screen and walk through some of the pieces of the scheduling module. And certainly if anybody has any questions, you know, submit them into the question piece there. And then also, if we're not able to get to your questions, we're going to follow up via email. So please don't be concerned if we don't have time to get to all of the questions today.
Thanks, Nadine and Jeff. Again, this is Stephanie, and I'm just going to walk through a little bit of the scheduling module so you can see what that looks like. I'm really going to focus on how the user interacts with it. Just know that when you decide to move forward with our scheduling EVV package, which is currently available, it was released last May. and has had many updates to it. So thanks for all of our users who've given us feedback on that module. But once you move forward with purchasing this module, you will work with our team to get set up and come up with an implementation plan for your agency. The training of the staff is very straightforward because really it's just a matter of them checking that they're in either on the map, on the mobile app, or if you're not worried about EVV, you have an option to do it from the web as well. But for the EVV requirements, you're going to have them use the mobile application. I'm right now in the browser and I'm showing you from the schedule admin screen. So for your EVV to be able to collect that data, you actually have to schedule that slot in order to have the staff act on that. So here is a look at the scheduling grid. So I've loaded, this is a demo account, so all these individuals are pretend. Here are my clients. I have a color code up here to let me know what all of these different colors mean. So you can see this is for James, and Rich was assigned to work this slot this morning. It's green, which means that it's completed. So that means we've got a check-in and a check-out over here. And he also gave us a verification, which is a signature on that. So you'll notice when it's this green color, it's actually got a red border. That's to let us know that the time worked is different than the time that was scheduled to work. So it's going to give you those visual cues. Anything that's blue is approved, so staff can now take action on those slots. Incomplete means we've got a check-in, but we don't have a check-out. And this is coming from the mobile app, so you'll see that address there where they checked in at. And then this red color here is a slot that we have scheduled, but we don't have a staff assigned to work it. So that's approved without staff. Anyone that has this individual on their caseload could do a search and find this open slot and volunteer to work it. Or I can use my SCOM option to send this out in an email option to other users to ask if they're available to cover this slot. So when you're creating a shift or a slot, you are assigning it to a specific individual as part of the EVV requirements, the service, and that is coming from the service authorization, which Nadine had mentioned a little bit earlier.
So you can tell, so you're only able to schedule somebody that's authorized for services. So again, that meets your EVV requirements, that somebody has to be authorized for services in order to gather that EVV information that's required there. And those limits that you're looking at there for that show up under his nursing services, you got 3 units per week and 21 units, 3 units per day and 21 units per week. That comes from the authorization. So you can identify what you would expect somebody to be, how much services they would expect to receive in a day. So then when your scheduling person goes to schedule that, they have that reference information, and you can see how much has been scheduled and what's left, and how much more services Royce needs.
Perfect. You can also assign the staff here, and you can add in daily and weekly work hour limits for those staff, so the scheduler can keep that in mind as they're selecting someone to cover this shift. These aren't hard stops, so even if you've scheduled or set someone as a 40-hour week, you would have the option to schedule them for more than that time for the week or the day if needed. This is where you can also indicate to your staff where this shift should begin. So if this is in the community, maybe it's at the program site, you've got your drop-down options. It'll pull their residential or mailing address from the individual data form, or the site address, which is associated with your program. You can also use your location function to look up a location. This works through Google Maps. And this is our Therap location. Sometimes your navigation tool may not drop the pin in the exact location. So as a scheduler admin, you can actually move that pin around to get the exact coordinates that you need. So this will pull the physical address and also the latitude and longitude of where that address is on the map. So you've got this indicated of where they should begin their shift. When they check in, it will pull from their location services on their mobile device or their iPad to show you exactly where they were when they checked in on that. If the shift is going to end in a different location, you can put a separate end location there. And you can also add a note here for the staff that they will be able to see when they're viewing their schedules, when they go to check in and out, they can refer to this. All right. So this is what the scheduler will see when they're creating the schedule, and they can see what status things are in. I'm going to switch and talk more about the user, the staff who's going to be actually using EVV, checking in and checking out. So back on our dashboard in Therap, over on the right-hand side, everyone will have this schedule, view, and check-in option. So even if you don't have EVV currently in your package, you will see this on your screen. It defaults there for everybody. So I'm going to click on View Schedule, and it's showing me just my personal schedule of what I'm scheduled to do on today. So it always defaults to today's date. I can move that forward or backwards. I can also see this at a week or a month at a time. It shows me those color codes again. I can view this here so I can see what I wrote. I can make an SCOM, which would be like an email to the scheduler, maybe to clarify something, or I can leave a general comment. I cannot take action. I can't create a slot from here. Well, actually, I'll show you self-check-in where you can, but this would not be meeting EVV requirements. If I check in on this slot from the web, which you can allow, it's number one going to give you an error because I'm checking in at 1:38 when I was scheduled to start at 1. So if I'm more than 15 minutes outside of that, it's going to require a comment. So now that I've given my comment there, you can see that there's no check-in address, which means it's not showing me the location of where I checked in and out from, and that's because it's on the web. You really want your users to access this on their mobile device. That can be from their smartphone or from a tablet, but they would need to be using the mobile application, which is what I'm going to show you in just one moment. I had mentioned earlier about those open slots, how if you schedule an individual-based slot that does not have a staff assigned, you can give staff the access to go in on their individual tab and do a search. And they can search specifically for unassigned slots. So if they are looking to pick up some extra shifts or seeing where there's a need, they can come in and find, here's that shift. And I could SCOM to say, hey, I want to work this. The other thing is the scheduler can send it out to the staff. All right, I'm going to switch to show you my mobile device now. So I'm going to be sharing from an Android. You will have this same functionality on an iOS device as well.
I also want to chime in, Stephanie, while you're doing that. We've had a couple questions about people asking if EVV is required for a particular service in their state. Each state varies in what services they require EVV for. So it's so state specific. We haven't seen, it is anything that falls under that personal care services is required. But as far as particular service codes or services, you definitely want to check with your state to make sure that any of those services that you provide that you can be prepared for.
Yeah, and I'll speak to that as well, Nadine, in that there are some states that are including IDD and additional services in waivers that some states are not. So as you said, certainly make an effort. Many of the states have their own website now up for their EVV requirements and services that are affected. Make sure and go to that state site and find that out specifically as to what services will be included. Many are starting with just a few and will look to include others as we move forward, but certainly it's necessary for each state to be investigated as to what is applicable and what they will be enforcing for EVV requirements.
Thank you for jumping in. Please feel free to interject if I'm missing anything. All right, so this is our mobile app. Again, I'm on an Android device. I've already signed in. With purchasing the scheduling and EVV module, you have access to the mobile app, and you'll see that scheduling EVV line. So this is, again, just my personal schedule. I'm not a schedule admin from this view. I'm only working as a staff who is assigned to work these shifts. So it defaults to today's date. You'll see those colors are here as well. I can see the orange is things that I've checked in for, but I haven't checked out for. Green means I've checked in and checked out, and you'll also notice that there's that circle with a check box or check mark in it. That means I've received or I've accepted a signature verification or a voice verification. So we've got this electronic visit verification where staff are verifying that they were at the service, they were at that location to provide the service for this individual at this time, and they're giving you all of that information. But we've also have an additional option where you can go in and collect another level of verification. See that verify option down there at the bottom, where you can receive a signature from the individual that's verifying this after the staff has checked in and out, sort of like they're signing off to say, yes, this is correct. I verify that this was correct information. So on this slide, I've checked in. I'm going to go ahead and check out. So it is using my location to drop a pin. I don't have the option to type in an address here, but if I pull up the drop down, I'll see other nearby locations. When I check in, I'm checking out late, so I need to add a comment because I'm more than 15 minutes outside of that scheduled time. So whether it's too early or too late, I'm more than 15 minutes outside of that time, I need to explain. Okay. All right, so checkout is successful. You can see my location there. I don't have the ability to modify this time. So the scheduler, and I'll show you that in a minute, the scheduler can actually go in and correct time. If there's a comment left or they need to make a change to the time in, time out, that can be edited. Maybe someone forgot to clock out. The schedule admin can go back in and manually update that time. The staff themselves do not have the ability to modify their time in or time out. It pulls directly from their device. So I can show you this verification option now. So we've got a signature verification, which is probably the most common. You also have a voice verification. So if you're working with an individual who is unable to sign, you could record up to 10 seconds of audio. I'm going to collect that signature, and it turns my device that I'm using into a touchscreen signature. So that has now been added to that slot. So when the scheduler views this information, they will be able to click and view that image of the signature like I showed you previously. And if it's audio, they will be able to listen to that audio. The staff no longer has access to that image or to that audio once they've submitted it. It's only available to the scheduler. All right, so we have completed a slot. We've left a comment, and we've verified. We also talked a little bit about the offline app. So if you're in an area where maybe there's no cell service, there's no internet service anywhere, so you can't check in and out with the mobile app. We actually have an offline app that is part of our mobile app. So what we have the option to do now is if you've got a slot here that you've created that you know you need to check in for offline, you can actually swipe to the left to add that to the offline app. So it's both in our production app here that we could check in or check out. And you'll notice the numbers or the time has changed to a dark gray. That's letting me know that it's gone to the offline app. So I'm going to show you that in just 1 second. I forgot I need to show you self-check-in. So let me do that and then I'll show you the offline app. The self-check-in option is good for services where you may not be scheduling everything in advance. Maybe it's a respite service, maybe it's a clinical service that is scheduled between the family and the staff person, not an admin scheduler putting it in advance. So you can customize who you want to have the option to self-check-in and what services are allowed to self-check-in. So in this case, I'm saying I'm checking in for a slot right now. I'm starting now, and I'm going to plan to work until 2:30. I have to choose my individual, choose my program, and my service. So it's showing me those unit limits as well that we saw on the main screen. If I select a program that does not have, has not been configured for self-check-in, I won't be able to proceed. So I'll see no service found. So only the users that you assign that service to that you have said can be checked in without a slot in advance will have that function. And from there, it works just like a regular slot. So I would just check in. I'm saying I'm reporting to work right now. So there's that slot that I just created, and it is in progress because I just checked in for it. Okay. I know that was quick. We've got other webinars where we go through this module in a lot more detail. So if that's something you're interested in, those are available on the Scheduling EVV overview page. I'm going to switch now to go to the offline app. So when you are needing to use the offline application, you would go to your regular app. You'll see there's an option to switch to offline login. So it's actually within the same application, the same interface here, so you don't have to install a separate application. So I'm going to put in my login name, and this is actually not your Therap password here. You would set a offline PIN that you would use. So here are the slots that I've added to my offline application. There's no PHI here, so I see that it's at 3 o'clock today, but it is identified by a number here instead of by an individual. When I touch there, if I'm ready to check in, I can go ahead and do that. You'll see that it has collected my time in and time out. And then the same thing when I check out, it's also going to collect your geolocation here. So you still get the EVV data, even though you're technically offline right now. And then the way it syncs up is when you log back into your regular account. Oh, good. It's just the pressure of having everyone looking at my screen. But when I log back into my regular account, I will be able to sync those up. So I'm going to get this message letting me know that I have some offline EVV slots that have not been uploaded yet. So I need to go ahead and upload those as soon as possible. So it will sync those check-ins, those times, those locations to the slots in our system. Jeff had also mentioned our interactive voice response option. That is a telephonic option, so you would be calling in from a phone. It could be any phone, but you can in the slot define which phone number you're expecting that to come from. It's only going to give you a time in and time out. It is not going to give you a location, and that is acceptable as sort of like one of the last resort options in areas where you just don't have the connectivity. All right, I'm going to switch back to my computer.
I think, Stephanie, as you're doing that too, I'll just mention one of the, I think, significant elements that the Therap solution provides as well is that none of that PHI is on the devices. If you're online, it goes straight into the cloud. It doesn't go on the device. If you're using the offline and you're syncing, again, no PHI is collected. So if you've got staff that lose devices or folks have instances where those get lost, and we all do, that have agencies run into this. This is a scenario to which you have the peace of mind to know that staff are able to do this and it's going straight into the application and not being collected on the device. So I'll just mention that again, from a risk management standpoint, it's a real peace of mind piece that I think many are comforted by knowing that. So I just mentioned that as well as Stephanie continues.
Awesome, thank you. So I did want to go back and just show you if you do have missed punches, or there's one, I think, or maybe, yeah, here's a missed timeout. You actually have the ability as the scheduler to come in and modify either the changing the time in or timeout, or adding a time if there's been a missed punch. So just like there was that user error, that error that they receive if they're trying to check in more than 15 minutes outside of what was scheduled, if they're trying to check in on something more than 12 hours outside of what was scheduled, it's not going to allow them to. So if someone forgets to check out and tries to check out the next day more than 12 hours after what was scheduled, they won't be able to give you an out time. So in order to calculate those hours correctly to see what that person works, you would want to go and make sure you put in that out time, or update that time as needed. Any updates that are made to a slot will be archived. The changes will be archived, so you can go back and find that. So there will be an asterisk here noted that this was edited by the scheduler, and then in the update history you can go in and compare what's the old version and the new version. All right, I want to jump in and show you some reports that we have for this module right now. They are found in the report library. And if you just search for EVV, they'll show up there for you. So the slot report is currently the most comprehensive report that we have available. And when you're running reports in your report library, it is going across your entire agency. So this is something that you would want to export to Excel and use your filters to narrow down your results. But this is going to show you every piece of information about what was scheduled. So we've got the name of the individual, what specific service, the staff that was assigned to work it, any note that was associated. We've got all of the location data, so where you said this was supposed to start and end, and then where they actually checked in from. So we can see the physical address, we can see the geolocation. It'll tell us how they checked in, whether it was mobile phone or the mobile app, IVR, offline. And then over here shows our times that was scheduled and check-in and check-out time. So you have a total here, the scheduled hours, so what you said their schedule should be, and then what they actually worked. So that's going to be based off of their time in and time out. If any comments were left on this slot by the staff, either a general comment or a check-in or check-out comment, you'll be able to refer to that on this report as well. So again, this is something that you would want to export to Excel. It's got a lot of different data in here. If you're just looking for time in, time out, and totals, you can access that here. You can see the comments, you can see location, you got it all in this one report. I'm going to go back and show you the weekly staff report, which is really more looking at hours worked versus scheduled. So it's broken down by week. So you'll see people repeat depending on how long of a time period you selected in your search. And it's going to show us for the start of that week, how many hours were they scheduled to work? And then based on their check-in and check-out times, how many hours did they actually work? So before you rely on this report as the truth. You would want to verify this, make sure there's no missed punches, no times that need to be modified from the scheduler's end, because this is only going to total what has a time in and time out. So you would want to use that slot report in your schedule review just to make sure that everything is correct before you rely on this report for your total hour count. All right, I'm going to go in and show you a schedule search. You can narrow down these results as you need to. So if you want to look at one staff schedules, one individual schedule, you can put in that information to narrow that down. I can also search for just open slots, things that don't have a staff assigned, if I want to locate those and make sure I get those filled. I just do a search for things that I'm scheduled for, and if I needed to, I can come here and create a printable option that I could share with the staff or the family member to let them see what their schedule is for this time period. Right now, we don't have a visual schedule in printable schedule in that it's not in a calendar format, but this is our first take on a printable schedule. It's got your scheduled dates, times, which individual they're supporting, which staff is working. All right, so that is what I wanted to show you here, but Nadine's got a few things she's going to talk us through for EVV billing.
I was just going to say, let's get to the billing piece because everyone wants to get paid for the services that we provide. Okay, all right, sorry about that. So we're trying to not to switch screens because it's just easier to present, but you know, I want to show you that I'm in the same account here. So if we go look at that schedule, you can see we'll look at some of the services that Stephanie was in earlier, just to show you that this is what she was scheduling earlier and what she showed you on the demo on her app earlier. So you can see we have some nursing services here for Royce and for Charles. So once we're done, once we've collected all of that service documentation, you want to go to the billing tab, and then here's that link to that EVV billing. And again, this works very similar to that ISP billing. So in your user privilege, you're going to need that EVV billing conversion as well. It's very similar to the ISP billing conversion. So if you're currently doing ISP, this screen probably looks pretty similar. Our ISP and EVV billing, as well as case note billing, all work very similarly. The difference is on your service authorization, it's your method of data collection. So with ISP data, you collect your data through a particular ISP program. Here, you're going to select EVV as your method of data collection. All of your other setup for billing is really similar. We have a unit calculation rule, kind of like you have for case notes. It's pretty similar to ISP. Also, it identifies how you're bundling your data and what times we're going to take into consideration to generate our billing. But once you start working in that, we can get into the details about how to generate that information and how to set up your system. So we're going to generate billing data for the month here for July 1st and 2nd. And then again, I can put a program in there if I wanted to. You can see Charles Allen comes up here because he had a service authorization for his personal care services. His unit rate is listed here. And we also want to make sure that when we're generating our billing data, that our check-in, check-out date is the same slot as when we're scheduled for. So also, if you have multiple staff moving in and out, that usually applies to a different service. So that's a different method of data collection there. And so here, when I generate that billing data is the same for all of our methods of data collection. You have attendance, you generate billing data. ISP data, you generate billing data. EVV is the same, you generate billing data. And when we generate billing data, we get that same billing data form, just like we do with all of our other methods of data collection. So it's really simple. The transition to using EVV billing is quite easy if you're already using our billing module. Like I said, it's a different method of data collection, but once you have billing data, all of your reports and everything is the same. So billing data is billing data is billing data, and then you can create your claims and submit your claims the way that you need to in order to get paid for the services that you've provided. So in closing, Stephanie, is there anything that you want to recap here or go over?
We wanted to hand it over to Jeff to wrap up. So I'm good for now, and Jeff's going to take us out.
Yeah, so a lot of questions. Thanks, Nadine. Thanks, Stephanie, for this. Again, there are several resources off the website that you can certainly go and dissect even to a more granular level if you're looking for aspects that maybe didn't get covered. This is, again, our EVV solution that is just a part of the comprehensive solution as a whole. You can see even through this billing portion how you benefit from that. And again, this is where we're at with it. It continues to evolve, continues to be enhanced. If you're looking for, you know, exactly more information on pricing or what's going on in your particular state, we have specific reps that you can reach out to that will be happy to discuss in detail of what's going on in your particular state and how your agency can benefit from what model your state has selected. So certainly reach out to us or to your rep that you have at your agency, and they can walk you through how to take advantage of this. Again, thanks so much for your time, and we appreciate just giving us an opportunity to give you an overview of this. Hope you have a great holiday weekend as that anticipates. And again, appreciate so much you spending a little bit of your afternoon with us here on this Tuesday. Thanks so much.